Understanding CPT code is a cornerstone of accurate medical coding and billing practices. Join me as we explore the significance of mastering these codes in healthcare industry. Welcome back to my YouTube channel. If you are new to my channel, welcome to MedCode Insight. Hi, I am Nashava, a certified medical coder. In this video, we will explore the procedural codes related to spine and spinal cords and upper abdomen. Without further delay, let's begin our exploration. Spine and spinal cord, the next anatomical site of the CPT anesthesia. The spine is also called the backbone and it is made up of vertebra. It has three main sections: the cervical, thoracic, and lumbar spine. Spinal cord is a cylindrical structure that runs through the center of spine, from brainstem to the lower back. It carries messages from brain to the rest of the body. First code is 00600, anesthesia for procedure on cervical spine and cord not otherwise specified. It means the provider performs anesthesia service for a patient undergoing a procedure on cervical spine and cord not described by another anesthesia code. Below this, in the parentheses, there is an instruction for percutaneous image-guided spine and spinal cord anesthesia procedure. See code range 01937 to 01942. Percutaneous image-guided. Percutaneous means through the skin. Image-guided means assisted by a picture. Next code is 00604. Procedure with patient in the sitting position. Next code is 00620. Anesthesia for procedure on thoracic spine and cord not otherwise specified. Next code is 00625. Anesthesia for procedures on the thoracic spine and cord via an anterior transthoracic approach not utilizing one lung ventilation. Anterior transthoracic approach means the surgeon approach the spinal column from the front of the spine. Next code is with utilizing one lung ventilation. Next code is 00630. Anesthesia for procedure in the lumbar region not otherwise specified. Next code is 00632. Lumbar sympathectomy. It means provider perform anesthesia service for a patient undergoing a procedure to cut off sympathetic nerve connections at the lumbar or the lower back region to increase the flow of the blood. Next code is 00635. Diagnostic or therapeutic lumbar puncture. Diagnostic procedures are for finding a suspected disease, while therapeutic relate to treatment. Next code is 00640. Anesthesia for manipulation of the spine or for closed procedure on the cervical, thoracic, or lumbar region. Manipulation is the form of therapy that allows doctor to move your body without causing any discomfort or pain. It means the provider performs anesthesia services for a patient undergoing a technique where practitioners use their hands or device to apply a control force to a joint on the cervical, thoracic, or lumbar spine. Next code is 00670. Anesthesia for extensive spine and spinal cord procedure, for example, spinal instrumentation or vascular procedure. It means the anesthesia services are provided for a patient undergoing an extensive spine and spinal cord procedure, including spinal instrumentation, where the provider implants plates and screw into the spine to stabilize it, and vascular procedures on the blood vessels. Upper abdomen, the next anatomical site of CPT anesthesia. Upper abdomen is the area of the belly between the ribs and belly button. First code is 00700. Anesthesia for procedure on upper anterior abdominal wall not otherwise specified. Anterior abdominal walls means the front side of the abdominal wall. Next code is 00702. Percutaneous liver biopsy. Percutaneous liver biopsy means inserting a thin needle through the belly into the liver and removing a small piece of tissue. Next code is 00730. Anesthesia for procedure on upper posterior abdominal wall. Posterior abdominal wall means the back of the abdominal wall. Next code is 00731. Anesthesia for upper gastrointestinal endoscopic procedure. Endoscope introduced proximal to duodenum, not otherwise specified. Gastro means stomach. Proximal means upper part. It means anesthesia service is provided to introduce the endoscope not beyond the proximal or upper part of the duodenum, the first portion of the small intestine just below the stomach. Next code is 00732. Endoscopic retrograde cholangiopancreatography. Retrograde means a movement that is opposite to the usual direction of flow. Cholangio means bile duct system. Graphy means taking picture. The anesthesia provider performs anesthesia service for a procedure during which the another provider introduces the endoscope to the proximal or upper part of the duodenum, the part of the small bowel just below the stomach. Next code is 00750. Anesthesia for hernia repairs in the upper abdomen not otherwise specified. Next code is 00752. Lumbar and ventral incisional hernias and or wound dehiscence. Wound dehiscence is a surgery complication where the incision or a cut made during the surgical procedure it reopens because of improper wound healing. Next code is 00754. Omphalocele. The provider performs anesthesia service for a patient undergoing hernia repair in the upper abdomen for a congenital malformation in which a part of intestine or other abdominal organs protrude into the base of the umbilical cord due to a defect in the development of the muscles of the abdominal wall. Next code is 00756. Transabdominal repair of the diaphragmatic hernia. It means the provider performs anesthesia service for a patient undergoing surgical procedure involves repairing a discontinuity in the respiratory diaphragm and restoring the protruding abdominal content back into the abdominal cavity via transabdominal approach. Next code is 00770. Anesthesia for all procedures on major abdominal blood vessels. Next code is 00790. Anesthesia for intraperitoneal procedure in the upper abdomen, including laparoscopy, not otherwise specified. The peritoneum is a continuous transparent membrane which lines the abdominal cavity and covers the abdominal organs like stomach, spleen, liver, first and fourth part of the duodenum, jejunum, ileum, transverse, and sigmoid colon. Lepro means wall of the abdomen. Scopy means viewing or examination. A laparoscope is an endoscope designed specially to examine the abdomen. Next code is 00792. Partial hepectomy or management of liver hemorrhage, excluding liver biopsy. Hepatic means liver. Ectomy means removal. Hemorrhage means an escape of blood from a ruptured blood vessel. It means the provider provides anesthesia service for a patient undergoing partial hepectomy, which is the partial removal of the liver, and undergoing management of liver hemorrhage. This code includes laparoscopy, but it does not include liver biopsy. Next code is 00794. Pancreatectomy, partial or total Whipple procedure. The provider performs anesthesia service for a patient undergoing a procedure of partial or total surgical removal of pancreas. The surgical provider may perform a Whipple procedure, which is the removal of the head of the pancreas along with the duodenum other nearby structures and rejoining the cut ends of the pancreas to the small intestine. This code includes laparoscopy. Next code is 00796, liver transplant recipient. It means the provider performed anesthesia service for a patient receiving a liver transplant, including laparoscopic services. Next code is 00797, gastric restrictive procedure for morbid obesity. It means the provider performed anesthesia service for a patient undergoing a procedure to shrink the volume of the stomach by putting a band across the stomach. This way, the stomach fills up sooner and the patient can decrease its food intake and lose weight. If you have any question or need further clarification, feel free to ask in the comment section or reach out via email. Thank you for watching. If you enjoyed the video, please like, share it. Your support means a lot to me. If you haven't already, consider subscribing for more. Click the bell icon to receive notifications. For more detailed guidelines, CPC mock or exam related questions and notes, email me at my giving email ID.